Hi everyone, today we are going to talk about the role of molecular assays in current practice. Molecular assays can be used starting from screening to the diagnosis and to monitor the disease burden. As you all know, for diagnosing CML, you need to test for BCR-ABL fusion. Risk stratification, for example, in cases of CLL, multiple myeloma, you have to risk stratify the patients into low risk, high risk, etc. Predicting response to therapy. There are many pharmacogenomic assays available today to predict the response and to predict the treatment efficacy or toxicity and to monitor the response to intervention and measurable residual disease. This can be done by IHC as well as NGS, and the disease evolution, clonal evolution can be tested with NGS. Fusion transcripts have been reported as the driver events in majority of sarcomas and can be in the right pathological and clinical context helpful as highly specific molecular diagnostic markers with significant impact on the classification of the tumor as well as in deciding therapy. For example, NTRK fusion positive sarcomas can be treated with NTRK inhibitors. Clonality assessment of the highly polymorphic immunoglobulin and T cell receptor gene rearrangements is an important tool in the diagnosis of lymphomas. Not only in the diagnosis, but clonality assessment will also tell you about the MRD status, measurable residual disease. Molecular assays can also be used to diagnose hereditary cancers. Analysis of microsatellite instability as a hallmark of Lynch syndrome associated tumors is used to select patients suspected of having Lynch syndrome before referring to a clinical geneticist. You can very well start a molecular assay in your lab. For that, you need to do in-depth literature review and follow manufacturer's recommendation and try to validate the new assay in your lab. You have to arrive at a conclusion by deciding its analytical sensitivity, precision, and the interfering substances or factors for the assay. So validation can be of two types, analytical validation or clinical validation. Analytical validation tells you how good the test is at detecting or measuring a particular analyte. That means you'll be knowing your assay sensitivity, specificity, linearity, and reproducibility. Clinical validation relates to how good the test is for answering a particular clinical question or disease. That means you have to decide whether the molecular assay which you are designing, whether is it of a diagnostic use or prognostic or predictive or to monitor the disease or to confirm the disease or just a screening test. You need samples for your validation. So samples can be mock samples, that is samples prepared from cell lines, commercial controls or standards in relevant matrix and in serial dilutions if it is a quantitative assay. Can also take patient specimens. Sample exchanges with another lab can also be done, and the ultimate thing is to participate in external quality assurance. Morphological correlation is possible with fish also, but it is expensive and signal fades over the time. PCR and different types of PCR, PCR based tests are very sensitive, cheap, but again the multiplexing is limited. Sequencing, again the sequencing is of various types, targeted, whole genome, whole exome, depending on your requirement. The assay is complex and it is expensive. It requires expertise for the interpretation. Thank you.